Hello, my name is Elizabeth Fonga. I'm a student with University of Massachusetts Global, and today we are doing some psychotherapy using three modalities with my patient who is attending her third session, which has been ongoing weekly with good participation. The patient in this scenario is a 40-year-old African American female who was referred to us by her primary care physician due to being depressed for over 6 months. Her husband left her for another lady and moved out of state a year ago, and she lost a sibling 6 months ago, which is what triggered her exacerbation. She lives by herself with her two sons. She reports feelings of guilt, embarrassment, low self esteem, rejection, low energy, loss of appetite, very little sleep, and loss of interest in things that she used to love doing, like dancing. She stated she prefers to stay in her room by herself most of the time. She finds it hard to shower or clean up for the most part of the week. For this patient, the three types of therapy modalities that will be used are cognitive behavioral therapy, interpersonal therapy, and motivational interview. Cognitive behavioral therapy, CBT, aims to modify maladaptive cognitive distortions and behaviors, enhance emotional regulation, and cultivate individual coping mechanisms that specifically address present difficulties. CBT operates on the premise that our ideas, emotions, and actions are interrelated, and that modifying negative beliefs and behaviors can result in alteration in our emotional state. Interpersonal therapy, IPT, improves relationships and communication to treat psychological disorder. IPT, developed by Gerard and Mirena in the 1970s, treats depression and other mood disorders, but can also address other mental health conditions. The goals of IPT is reducing symptoms of depression, enhancing the quality of interpersonal relationship and social functioning. It also builds a stronger network of social support. Motivational interviewing is a technique that focuses on the client's needs and uses guidance to increase their internal motivation to change by examining and resolving conflicting feelings. Motivational interviewing works well for depressed people, hopelessness, patients that lack motivation, and ambivalence about change, which are common symptoms of depression. The empathic and supportive approach of MI can assist solve these difficulties by motivating and empowering clients. Now, how are these therapies appropriate for my patient? CBT is appropriate for this client due to its ability to target cognitive and behavioral symptoms. It provides practical strategies for symptom management, and its solid foundation in research is applauded. The structured, goal-oriented, and empowering aspect of this treatment makes it highly effective for treating depression. Motivational interviewing enhances patients' self-efficacy in making beneficial adjustments. This heightened self-efficacy can be especially advantageous for those with depression who frequently deal with diminished self-worth and uncertainty about their abilities, as in the case with my patient. Interpersonal therapy helps patients navigate and cope with significant life events such as grief, role transition, interpersonal disputes, and social isolation, which can trigger or exacerbate depressive symptoms. Now, what are the overall expectations after my encounter with the patient? After successfully completing these therapies, the client will have the skills to change maladaptive behavior and thinking. They will also achieve lasting improvement in mood and functioning and a sense of well-being. We expect an elimination of or reduction of symptoms, improved interpersonal functioning, and a great understanding of the presenting symptoms, which will help prevent a relapse. Now, what are the aspects of culture regarding my patient? As you know, my patient is an African American lady Mental illness is stigmatized in many African cultures. Mentally ill people may be seen as weak, dangerous, or have a bad spirit. Social isolation and discrimination can discourage people from seeking treatment due to stigma posing an obstacle to care. Spirituality and religion are often important psychological coping mechanisms and a source of resilience to African Americans. Disclosing one's difficulties and secrets to individuals outside of the family is strongly disapproved of in the African community as it casts a negative light on the family. Cognitive behavioral therapy will empower my client to modify any unpleasant emotions and erroneous convictions. During CBT, the therapist and the client collaborate as partners, allowing for the open expression of thoughts and emotions that may be disapproved of in the African community. CBT empowers patients to become their own therapists, enabling them to take control of their thoughts and behaviors. It provides patients with the necessary tools to comprehend their present cognitive and behavioral patterns and make positive changes to overcome maladaptive patterns. Interpersonal treatment stresses healthy relationships and familiarity, which Africans cherish. African families prioritize relationships. Therefore, IPT helps people cope with stressful situations like role transition and improves trust and communication. Motivational interviews avoids counseling, which makes Africans feel passive and unable to contribute. Motivational interviews use active methods. In conclusion, integrated therapy will improve this client's outcome because all therapeutic methods target patients' concerns. Finally, for this client, offering an integrated therapy options can help normalize seeking help for depression, reducing the stigma associated with mental health treatment. This is particularly important in cultures or community where mental health stigma is prevalent, given she's from Africa. Motivational interview was used pre-treatment to boost self-motivation and during CBT to build client-patient relationship. MI can integrate CBT methods and other therapies. Evidence-based research demonstrates that integrated psychotherapeutic treatments provide a multifaceted approach to mental health care, making them effective for managing and treating depression and other psychiatric diagnoses. MI will be utilized in my next session. The client will be provided guidance in order to devise her own trajectory towards recovery, generating multiple alternatives for her to implement transformative changes. The primary methods of communication to encourage change discourse will involve utilizing important techniques such as open-ended questions, providing affirmations, engaging in thoughtful listening, and summarizing. Right. Now, let's meet my patient. Hello. Good morning, Miss Shauna. Do you understand and give consent for these sessions to be videotaped and submitted to University of Massachusetts Global?
Yes, I do.
Now, let's start our session. How are you today?
Minimal progress. I sent my mood journal by email.
You did? We'll discuss it.
He believes that I'm experiencing depression.
Who believes that you're experiencing depression?
My primary care physician. But hey, I'm not depressed. I'm just sad as I have a lot going on right now.
Well, tell me what is going on in your life right now.
Well, everything.
Could you please provide some details or expand on your statement on everything?
Sure. As you know, my husband decided to leave me for another woman, leaving me with our 2 sons. I also lost my brother a few months ago.
Sounds like a lot to deal with. How does this make you feel?
I feel sad, lonely, and worthless.
How have you been dealing with these feelings?
I stay in my room all day, cover up, and try to go to sleep, but I've been coming out more now.
Oh, you isolate yourself in your room because you feel overwhelmed dealing with your sons, coupled with the fact that you lost your brother?
Absolutely.
Which of the concern is affecting you the most?
Losing both my husband and my brother.
How do you want things to be different?
I want the old me back. I used to be happy. I used to dress up for my husband, go out shopping, and hang out with the kids.
How important is it for you to feel free and able to move on a scale of 1 to 10, with 1 being the least?
At 8,
Nice. What will be some of the benefits of having the OU back?
I know my boys will be a lot happier.
So, what steps can be taken to get the OU back?
I can start doing some of the activities that I liked doing before that makes me happy.
What are some of the activities that you used to do that brought you pleasure that you stopped?
Going to church, shopping, and watching movies with my boys.
Which of these activities are you open to considering starting again?
I don't know because I don't feel like doing anything.
Would you consider finding the willpower to at least resume one of the activities as a stepping stone to regaining your journey to freedom?
Well, I guess I can start going back to church, but not as frequently as before.
When you go to church, how do you feel?
I feel like all my burdens are lifted.
Sounds like church is a place of uplifting for you.
Definitely.
Is there anyone that can take you to church?
Oh, yeah, my mom will be willing to drive as she always wanted us to be close to God.
Will you be willing to go to church with your mom?
Sure.
Let's write down your plan.
I can start going back to church with my mom on Saturday.
If I heard you right, you're willing to go to church with your mom on Saturday, correct?
Yes, and I'm willing to give it a try because I want my old self back.
Sounds like a plan. I would like to see you back in a week and we can discuss how successful your plan has been. Does that sound okay to you?
Sure.
All right. Thank you for coming and see you next week. Cognitive behavioral therapy will be utilized for the next session. Socratic dialogue will be utilized to explore how the client came about this negative thought. We will evaluate the evidence regarding this thought, and Socratic questioning will help the client examine the validity of her negative thoughts and get a broader and more realistic perspective. Hello, Miss Shauna. Welcome back to our next session. How are you doing today?
Not too bad. I completed the mood log that we talked about.
Awesome. Let me take a look. Your mood seems to fluctuate between 3, 4, and 5. Anything happening since our last session that you would like to share with me?
Nothing. Same situation as what we discussed in the last 2 weeks.
In the last session, we discussed your mood and you shared some background information that led to you feeling hopeless, guilty, and unlovable. How would you describe your mood today?
Not sure. I'm feeling sad because my mood log did not show one moment of me being at my best.
How does that make you feel?
It makes me feel sad. I used to be very happy and I want that person back.
Oh, good to know you want your old self back. What treatment goals would you like us to work on today?
We can continue from last week.
Sure. Last week, you identified some core beliefs that likely contributed to your current distress. I would like to explore them and see if we can get to the bottom of it. That can form a logical conclusion based on your experience that led to your current state of mind. What do you think?
Sounds good.
By order of importance, list 3 core beliefs that comes to your mind.
I'm unlovable, I'm useless, my life is a mess.
Okay, let us discuss each thought at a time. Do you feel unlovable?
Yes.
What makes you think you're unlovable?
My husband left me for another lady.
Could there be any other reason why a husband can leave a relationship?
Yeah, if they were never in love with their spouse to start with or an unresolved situation.
Could you tell me another situation that occurred that made you feel unlovable?
Of course, after my husband left, people believe that I'm not good.
Who are the people you're referring to?
The people in my church and in my ethnic community.
What makes you think that the people feel that way?
I just know.
What were the reactions of these people when your husband left?
They came to the house at different times, brought food, cooked, cleaned, sang, and prayed for me. They were actually very supportive. A lot of them still call and check on me.
Did they call you when you lost your brother?
Oh my god, come on. They were everywhere in my house, consoling me, cooking, and looking after my sons.
Do you think that people do all these things you mentioned to people they believe is no good and unlovable?
Wow, I might just have come to that conclusion on my own.
Okay. One of your homework for the next session is to list five more negative thoughts that you have that you have been including the ones that we're not able to go over today. How the thoughts make you feel, how you respond to the feeling. We will go over it at the next week session, and you will also do your mood log and bring it back to our next session. Does that sound like something you can do?
Yeah.
Thanks for coming. See you next week. ITP will be used for the next session. I would choose the problem area of road transition because both the onset and maintenance of depression episode is associated with difficulty coping with changes in current life situations. The role transition for this client is moving from being married to being single. We will focus on the patient's disturbed personal relationship that both caused and exacerbated her depression.